Only more bebre say, money with Jumadin, and Bema if you phone so a hand won't. And indeed, well remit a day and she said, Pa, Egua Quamu, so will be to me a sika amani if you for our abefo a quanso, computer, smartphone, and answer app, or how biara anyway. So we are a new customer, and answer a unit dear, any kind quadia at have you what then, and it's over to me amani sika free bontra, untia, a washe, Emma, well remit. San and Prince as 3 times, Umpewe na open, Tiang, and it just and it's over to me amani sika. Akusi MTN and as a Ghana network biara swa how biara anywho well remit we are summon shampa.
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp SMS IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp SMS IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid Health Insurance Program. Need help to apply? Contact United African Organization, WhatsApp SMS IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
Yo, Yamamu Akwaba Bio Aba Ako Radio. So I health and wellness Masuguswa Muti. Every Sunday say yeah, but Bia will be anywhere in the world. Program has Uti Ako Health and Wellness because I had Munkwana Yadi Apomodin Sembremwa just unfiltered. Right from the source. You know, specialists, just experts. Amunkwana do go. Yentimi and start to show you a bra any Yankopon says so boy ho ban mana chona kwa proper to ye na sibebe. Of course, listeners, viewers, most so the money na say munu wan ge ni ho mo ho ntina na no ya ba e ba be du dwumadi ni na and no de be kan ho asem ni friend dental health na ye ne any ababa wo bi at say what say any to say dental you know staff na the be na enya asem ketwa Nasam Ketokra. Na me pese medina ni na mo no amu aba no amu aba be kasama no. Enti Beryl net say how are you? So for the disclaimer today, we'll be switching it back and forth, right? So yeah, will be no be nyane de but for babam tree babam. Yeah. But for no bano I'll try to put it in tree for you. All right, go ahead, Beryl.
Okay, well, thank you so much for having me this morning. As he mentioned, I will speak mostly in English. My Twi is not great. If I try Twi, don't laugh, but I'll try. My name is Dr. Beryl Otchere. I am a general dentist. I graduated with my doctorate in dental surgery back in 2019 from the UT Health at Houston, Texas. So I've been practicing as a general dentist for the past 2 years. And today I'm here to talk just about dental health because a lot of people don't know a lot of the things I'm going to share. And it's very important for us to take care of our teeth, especially as Ghanaians. We also have to prioritize dental health. So I'm here to talk about that today. Should I go ahead and get started with my presentation? Or
yes, please.
Okay. So I'm just going to give a lot of information and then we can have questions at the end. So just make sure to keep your questions in your mind. And I want to start off and just talk about the importance of teeth, because that lays a framework for why you should even care about this presentation. And I like to talk about three main factors that make teeth so important. So the first one is nutrition. So doesn't matter what you're eating, imuto, fufu, kontomri, you need teeth, right? You need teeth. So nutrition is the first thing that's very, very important when it comes to teeth. The digestive process actually begins in your mouth. So your teeth allow you to break down the food initially and start that breakdown before your body digests it. So that's the first reason that your teeth are so important. And you'll realize if you have ever had any issues in your mouth, toothache, broken teeth, you notice that you have trouble eating, and it will affect your nutrition. The second most important aspect for teeth is speech. You may not realize that you actually need your teeth to speak. Those who don't have teeth or are missing, especially their front teeth, have a difficulty making certain sounds like S sounds, F sounds. So you need your teeth for speech. And then the third thing is aesthetics or just appearance. A lot of people associate their appearance with their smile. And so if you're not confident in your smile, maybe you won't be confident speaking in front of people or putting yourself out there or doing a variety of things. So it's actually very, very important, because I have patients who come with one issue and I'm able to help them smile. And they're like, oh, I was able to get a job. I was able to find a life partner. So many things can come from just confidence from your smile. So that's what makes teeth very important as well. And so just as an introduction, some of the basics of teeth, we all have two sets of teeth. When we're born, we have none. And then starting around 6 months, you start to develop teeth. 6 months all the way to about 2 to 3 years old, you're developing your first set, which is your baby teeth or your primary teeth. And then around age 6, all the way up to 17, 18, you're getting your adult teeth. So in all, you should end up getting 32 adult teeth when it's all said and done. And God being so good, he's kind of given us these two sets. But once we get that second set, that's it. So if you lose one, you break one, they have to be fixed. There's nothing else coming in to replace those. And God has also given us different types of teeth. I won't go into all of that, but they have different functions and purposes. So you have the ones in the very front, the side, towards the back and the very back. And it goes from biting to chewing in the very back. And they all have different functions and different kind of anatomy that I, as a dentist, had to study in detail. But basically all you need to know is that you have different types of teeth. And in all, in adulthood, you should end up with 32. And they're all going to serve very, very important functions for you. And so that's just a little bit of introduction to teeth. But now I want to talk a little bit about how should we take care of our teeth? How can we prevent issues? Because there are a lot of issues that can happen in your mouth, and I'll talk about them going forward. But I want to start off with just the prevention, because prevention is better than cure. We all know that. So if we're doing these things every day, we can prevent a lot of issues. It sounds very simple, very easy, but some of the things, I'll give a little bit more information. Hopefully you'll learn something you did not know about it. So the first thing we all know is brushing your teeth. Very, very important to brush your teeth every day. You can actually go up a little bit. The one that says prevention of dental disease with picture of brushing. So you should be brushing your teeth 2 times per day. Every morning, every evening. You should be brushing your teeth. It's very, very important. And you should be doing that not just anyhow, but there's a technique. So I have some pictures here. As you can see, they're getting all the different surfaces, the front, the back, the sides, the chewing surface. And you see there's an angle here. They advise to use like a 45-degree angle so that your toothbrush is getting into the gums as well as the tooth surface. And with that angle, also circular motions throughout. So you want to be doing that 2 times a day, morning and evening. And each time you want to be doing it for 2 minutes. So though, as you'll see, there's kind of a rule of 2s here. 2 minutes, 2 times per day, brushing every surface, outside, inside, up, down, every surface of the tooth that you can imagine, and also your tongue, because your tongue can harbor bacteria as well, and that can cause odor in your mouth. There's bacteria, as I'll talk about, that are already in your mouth. What we're trying to do is remove the bacteria and also remove all the food you've consumed, especially the carbohydrates in your diet. So brushing is very important 2 times a day for 2 minutes and all these different surfaces. And then something else you really want to be doing is flossing. It's not something a lot of people do. Statistically, we know as dentists, it's a very small percentage of the population that really flosses. But it's very important because you can brush very well, but there's something that you're missing when you don't floss, which is the part where the 2 teeth touch. And that's where food actually likes to get packed and cause issues, infections, cavities, and things like that, which I'll talk about. So floss is, if you don't know what floss is a string you can buy in the same aisle you buy your toothbrush. You can wrap it around your fingers and just go between all the teeth. They have a lot of new technology. They have a different type, which is a flosser. They have a water pick, which is electronic, that shoots water through. Those are all good resources as well. But if you can just get regular floss, that's good. You just use the string in between your teeth. That will be very important and helpful for you to prevent food from being packed between your teeth. And like I said, that's very important because as a dentist, that's where I see a lot of people developing issues, is between the teeth when food gets packed. Especially, you can imagine if you eat meat and meat is there, it's better to use floss than anything else. I know that we have toothpicks. Toothpicks can kind of poke the gums and irritate them. So floss is the best resource to use when it comes to preventing issues in between your teeth. And so prevention is so important. We stress that we don't in. So just to recap on prevention, basically, like I said, it was brushing. You should be brushing your teeth 2 times a day. I didn't talk about types of toothbrush, but I do want to mention that Korean bristle toothbrush. I know as Ghanaians, we feel like we need to use the hardest toothbrush and brush as hard as we can. But it's not about the how hard the toothbrush is. It's actually more about the technique. If the toothbrush is too hard, you can actually traumatize your gums. So you want medium or soft bristle. You'll see that on the packaging. And then, as you know, right now they have electronic toothbrushes that, they spin. And then they also have the regular ones. Both, if you're able to purchase an electronic toothbrush, like the Oral-B or the Sonicare, they're a little expensive, but they're actually very, very efficient as well. So those are also very good resources for brushing. So you want to be brushing 2 times a day for 2 minutes each time. And like I mentioned, flossing is once a day. So if you can do that just every evening or morning to fit it into your routine, it's helpful. And then I also want to mention that you should be, as best as you can, visiting a dentist 2 times a year as well. So that goes along with my rule of 2. Brush 2 times a day for 2 minutes and also see a dentist 2 times a year. Now, I know there's a lot of issues, access to care, but you have those visits usually covered. If not, there are community dental clinics or federally qualified health centers. So whatever you can, it's good to see when we have to examine your mouth, the trend to see. Maybe you that pain in your mouth, you don't have issue, but there are some things that we can see that maybe you have seen and catch and fix the issues with all the X-rays. And the X-rays, a huge part of the diagnosis is there things
Beryl. Yeah, it looks as if we're having issues with the internet. It looks like it's coming in and out. Yeah.
Okay.
Can you come back in, and then can you go out and come back in?
Yes.
Okay. Well, bro, yeah, certain app, no, not just the old Kenyan, and some people we have more questions because if some the guy is into 3 years, then also so traumatized, also to me traumatizing. Hey, some people do as you. None of the hair, baby. The more Ghana for the said most of them no dentist for all. A hospital and gas acquire and let alone go to a dentist. And information when you are there because tell you what kind of twice a year I saw go dentist. I mean, how many times now you back home where you call dentist paying? Obukan could be that. It's very, very, very important. The Baba Modiana yet me, I yet me acquire dentist. You're going to go in Krato, and by a certain apple, a banner about it was.
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid health insurance program. Need help to apply? Contact United African Organization, WhatsApp, SMS IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
Okay. Listen better. Hello. Can you hear me? Oh, I can't hear you.
Yeah, you can continue now.
Okay. I can't hear you though.
Really?
But I can continue, but I can't hear you.
You cannot hear me?
I have my volume. I heard the commercial, but I don't hear you.
Huh? What's going on? You still cannot hear me, right?
I can't hear you.
How about now? No?
Mm-mm. I can't hear. Should I come out and come back in again?
Yes, please. Yes.
Okay. Sorry.
All right. Yes, I'm Koji in Katoni Bimumra.
Hey, this your girl coming all the way from the US of A, ya baby, aka ya Vandam. And me di fill up bows in pan and to see one roach with your money how. Ghana mat ada romantic. With me sandy provisions, as I such credit, Emma Ebusia Fona and the form one Ghana. And one is a www.ghanamat.com. And they would say, boy, a sharp connection. www.ghanamat.com. Let's provisions in the credit. Na very young as Ankasa. I have friend numbers, Nana screen as Ghana Mat, ye crano.
Ghana Mat, ye crano. Ghana Mat, ye crano. And Saya Jinkato and free UAO. Sadabaya, I miss him rather than I am Beryl on Swaba back now. The mother in Abram.
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS IL65 to 420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid Health Insurance Program. Need help to apply? Contact United African Organization, WhatsApp, SMS, IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
Hey, this your girl coming all the way from the US of A, yeah baby, aka yeah Bantam. And me di feel a boozing pan and to see one virtue the money how Ghana mat ada romantic. What's me sending provisions as I such credit Emma Ebusuya phone and for more Ghana. And one is a www.ghanamat.com. And they would say, boy, a sharp connection. www.ghanamat.com. Let's show more provisions in the credit. Na omu vili yanga zankasa. I have friend numbers na mo screen na seno. Ghana Mat ye krano.
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid Health Insurance Program. Need help to apply? Contact United African Organization, WhatsApp, SMS IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
Mpanin kan a wɔmoa sɛ ɛnyɛ obi biribi ɛne obi na mo obi biribi ɛne ne a waye ne yi abusua ɛbrɛ ti sɛ mu so bi bɛdom aboa wo ama kakra mpa na oni akomdwe no ho yi pa well remit enim ne dia ɛyɛ tutu ɛfa sikasɛm ho oni mo abɛbrɛ sɛ mɔde wadwumaden ɛne mɔde biara a wobɔ sɛ wobɛma efiefo nso ɛho aheha wɔn ɛne nti well remit ɛde nhyehyɛ pa agua kwan mu sɛ wobɛtumi de sika ama ne efiefoɔ wɔ abɛɛfo kwan so computer smartphone anaasɛ app a ɔhaw biara ani ho sɛ woyɛ new customer anaasɛ ɛyi ne deɛ a ɛdi kan ko adeɛ a atadwe wate dɛnnɛ ɛne sɛ wobɛtumi ama ne sika free bonto a wontua ɛho hwee ɛma wɔ remit saa ne mprɛnsa so 3 times wompɛ wei na wopɛ tiɛn ɛne gye sɛm ɛne sɛ wobɛtumi ama ne sika yi akɔsi MTN anaasɛ Ghana network biara so a ɔhaw biara ani ho wɔ remit woyɛ yɛ sama nhyia mpa.
During this period, any little savings helps. World Remit knows how hard you work for your money and are making it easier for you to support your loved ones. World Remit prides itself in offering you a fast, simple, and secure way to send money abroad from the comfort of your home, using a computer, a smartphone, or an app. If you are a new customer, enjoy your first 3 money transfers with no World Remit fees whatsoever. Use promo code 3FREE. World Remit, a better way to send money. Terms and conditions apply.
What else?
With the I'm sorry, send me and my to me. Afraid that you'll be out and I could read you. I'm saying I ain't your friend, no sound. So I was a Janaba and an African tank and a piao, white treasures so a chow pa. Things say they be the knuckle and the move on. I am in your band and trust my Beryl. Welcome back. Well, you muted yourself so we can hear you.
Okay.
There you go.
Okay. All right. Sorry about that. So I guess we can continue.
Yes, right from where we left off. Yes.
Okay. Sounds good. I was just wrapping up the prevention part. So I was recapping. I think I kind of got through that already, but I had already mentioned that you should be brushing your teeth 2 times per day for 2 minutes and flossing. And I mentioned the importance of also visiting a dentist. So we'll move on. So now I'm going to talk a little bit more about just kind of the consequences or what can happen when there are issues in your mouth or something goes wrong in your teeth. So before I go into the actual consequences, this first diagram, I just want to highlight the fact that your mouth is connected to the rest of your body. And it's very important because there's so many things that can happen as a result of issues in your mouth. One great example is that diabetes, which is a very common illness. If you have gum disease or issues with your gums, you're more likely to have diabetes. And at the same time, if you're a diabetic, you're more likely to have that gum disease. As we know, diabetics can get foot ulcers. They can get a lot of issues. But gum disease or issues with your gums is one of those things. And this diagram shows so many things: lung disease, stroke, heart disease. They've established connections between a lot of these conditions and dental health. So that's what makes this important. So this next picture shows you, it says the stages of tooth decay. I'm going to explain more on the next slide, but basically over time, what can happen is that there can be an infection or cavity in your tooth, and it can go deeper and deeper. It can start at one level and it can deepen within the tooth until it gets to a point where you have pain and other issues. And so I say that to just go into my next slide and really explain what exactly is a cavity. So you may have heard that term before, dental cavity or decay. That's the number one issue that people present to me with at different levels. So what ends up happening is that our teeth have different layers. I don't want to go too detailed, but our teeth have different layers. The outside that you see, and then the inside, and the very inside, there's a nerve there. There's blood supply, and it's very, very important. It's what makes your tooth living. And so what can happen is that when you're eating, there are a lot of sugars in our diets, processed sugars, but even sugars we're not aware of, sometimes fruits, carbohydrates. So there's sugars in our diet. And there's already bacteria in our mouth. Everyone has bacteria in their mouth. Even when you brush your teeth, there's still some bacteria because they're just bacteria that are native to the mouth. But if you allow sugar to sit on your teeth for so long, the bacteria actually basically consume that sugar and break down the tooth structure. So you see in this picture, there's a small hole in that tooth. That's a cavity. That's what happens when the sugar and the bacteria interact and they actually break down the tooth to where there's a small hole. There's levels to this. There can be a very, very small cavity that it's not really a problem. If you continue to clean your teeth, it will resolve. But then it can go deeper, and it can go deeper. And what can end up happening is that the cavity actually gets to a point where there's pain. Or in fact, it's an infection basically that's going on. You can think of it as an infection of your tooth, but it can go deeper and deeper. So that's the main issue we see with teeth. And then when it gets to that point, as a dentist, I have to intervene. There's something that has to take place. There's different treatment that I can do to fix that. So when the cavity is small, I can clean it out. And what will happen if you come to see me and you have that is I'll put anesthesia, local anesthesia in your mouth so you don't feel that area. I will clean it and I will fill it with a material that's compatible to your tooth that will help save that tooth. But if it gets to a certain level, or it gets to where it breaks down a lot of your tooth, I may have to take that tooth out completely. So I'll kind of go into that more. But basically, that's the basics of cavity. Bacteria and sugar interact, and they break down the tooth. Okay, so that's cavities. And then the next one I want to talk about is gum disease or periodontal disease. And so we should all know what gums are. All of the pink or red colored tissue around your teeth is called gums. And that really just houses your teeth and just covers them, protects them. But what can happen over time is if this bacteria I'm talking about, if you're not cleaning your teeth well, if you're not flossing, you're not brushing the right way or brushing often, if you're not seeing a dentist, also if you have other pre-existing conditions such as heart disease and diabetes, all these things can factor in. Also, if you're aging, so if you're getting to your 60s, 70s, 80s, over time, sometimes you tend toward these things. You can get gum disease. So basically the bacteria goes into the gums, breaks it down, and you see this person, this is a severe case where the gums have receded back a lot. The bone level has receded back. And at that point, the bacteria has gone so deep that you yourself can't even clean it that well. A dentist or hygienist has to intervene. And so with the same as with cavities, there's levels. It can start small and it can get big. Gum disease can start off mild and it can get severe. So there's different levels. My next slide shows you just what a healthy gums looks like. It's pink, it's tight, it holds onto the tooth. That's what most of our gums probably look like. But then the next level is gingivitis. Gingivitis is just inflammation of the gums. Gingivitis is actually the one underneath healthy. Sorry. That one is just where it starts and it's a little bit inflamed, a little red. If you don't know, if you brush your teeth and you see bleeding, that's gingivitis most likely. Or you floss and like it bleeds a little bit, that's gingivitis. It's not that severe. It's reversible, but it's it can be dealt with. Then when you get to periodontitis or gum disease, this is actually irreversible. At that point, gum and bone has broken down. The only way to fix it at that point is to get a deep cleaning. So a hygienist or a dentist will get in and clean all of the buildup in bacteria. So there's moderate and then there's severe. So when it's severe, you've lost a lot of gum, a lot of bone, and your gums are just not healthy. So you can get a deep cleaning, or at that point, maybe some of the teeth may even be moving and they may need to be pulled out. So that's like a severe level. If it gets to that point and teeth are moving, then we can't really do anything for them. So prevention is better than cure. So we can actually prevent all of this if we're taking care of our teeth the right way. So the last thing I'm going to talk about before I open it up for questions is treatment. So I talk about some problems, cavities, gum disease, broken teeth. There's all sorts of issues. How can we fix them? So this is where I come in. This is where my expertise and my training comes into play. So I've been trained to do all these things. One is a filling. So if you have a cavity, that little bit breakdown of tooth structure, there's still a lot of tooth left, enough that we can work with. I can just go in and clean it out and fill it. So that's why I'm showing here as a filling. I also showed a tooth that broke, and it broke in such a way that we could restore it. Now these ones, they're pretty broken, but the dentist did a very good job of restoring them. We use a material that we actually apply to the tooth and bond it to the tooth, basically. And it will look like a tooth, function like a tooth going forward. So that's a filling. Those are very simple procedures that most dentists we do on a day-to-day basis, a lot of them. The next one I want to talk about is root canal. You may have heard that term before. So root canal is when there's a cavity, as I mentioned, but it's very deep. So the infection has gone deep inside the tooth to where you have pain. Typically, a toothache, like you wake up in the night and you feel your tooth. If a cold touches your tooth, it's very, very painful. Not sensitive, but like very, very painful. If cold or hot touch a tooth. Some of these patients, if they even bite on that tooth, it's so painful. At that point, you need a root canal, which means I need to go in and clean out the cavity, but I also have to go deep in the tooth, into the roots, and clean out the root with instruments to basically clean all the infection out and then fill it back up. That's a root canal. You may have heard that term, or a dentist may have told you need a root canal. At that point, it means it's a little bit more invasive than just a regular filling. But once that's done, the pain should stop, because actually the root canal, we take out the nerve completely. We take out all the infection. And so there should be no pain, and the tooth should be comfortable after that. A couple other things I'll talk about with treatment. Dentures. So everybody has heard of dentures, fake teeth. So if it gets to a point where you've lost some teeth, so some of the teeth have broken or infection, and a dentist has to pull them, at some point maybe you're missing a few. So we can do a partial denture. Partial denture is going to replace just the teeth that are missing so that you have enough teeth to chew with, you can smile, and it usually will blend to your mouth, and it's custom fit. So that a dentist has to take an impression and a laboratory has to make that. The other one is complete denture. I hope none of us will need these. I hope none of us. I think as Ghanaians, we actually take really good care of our teeth. So I've seen more Ghanaians with partials, but it's rare. I haven't seen a lot with complete dentures. But the white people, yeah, they get them a lot. So what ends up happening is if your teeth are so bad, like the gum disease is severe, or so many of them have broken, there's a lot of factors that can go into this. Like I said, not taking care of your teeth. Sometimes people who smoke or use certain drugs, they will lose all their teeth. Then at that point, you need a complete denture. So that's basically what that is. It means that you have no teeth left. We have to start from scratch. That's dentures. So that would create that need for that complete denture. So the next one is crowns. You may have heard of a crown. Someone say, I need a crown on my tooth. I have a crown. So you see how this tooth broke here in this first picture? If a tooth breaks so much, I can't just fill it, patch it up. I can actually do a crown. So the crown, I just kind of prepare the tooth, and then I have a cap that's custom fit to put on the tooth, and it protects it and covers it, especially if the tooth has broken or if you've gotten a root canal done. A lot of times we'll do a crown on top. And then a bridge is, you may have heard of bridge. I won't go into too much detail, but basically bridge is there's a tooth that's missing. We want to replace it. So I prepare the two adjacent teeth. I take a special impression, and then the lab creates the bridge that I cement onto the tooth. These are both things that are cemented onto your tooth permanently. So it's going to protect it or replace a missing tooth. So the bridge is mainly to replace a missing tooth. And then the last thing I'm going to talk about is implant. That's the other option to replace a missing tooth. That's the way of the future now. A lot of people are getting implants. I'm sure they're even becoming more common in Ghana as well. An implant is basically a titanium screw that is surgically placed into your jawbone, which sounds very, very invasive, but again, you're not aware of it. You're numb. You use local anesthesia. So we place that in, and we allow it to integrate to your bone for about a few months. Basically what that means is it becomes like a root, because it becomes like strongly adhered to the bone. And then we put a cap on top, and then all you know is you have a new tooth. You had a no tooth there, and then you have a tooth then. So we have patients who they have a trauma and they lose a front tooth, they can get an implant. A tooth in the back breaks or infected, needs to be taken out, they can get an implant. So implant and bridge, you can consider both, but there's like pros and cons and different costs to both. So those are just some of the treatment that we can do. And the prevention, that's all my presentation. I have prevention, dental disease, and then treatment. And basically, this is the information I wanted to present to you. And I wanted to allow you to ask questions about some of the things that I talked about as well. So thank you for listening.
Well, thank you so much. Thank you so much. We're going for a commercial break, right? When we come back, we will take the questions, and I have a lot of them for you.
Okay.
Yeah, I have a lot of those. So keep your questions coming. If you're on Facebook, you can, go to the comment section, put your comments and everything, and then we're going to read them for you. Okay. I see Joanna Ban and Nasafu Kantanka. He says, hey, the Brofo is too speedy. Nana, please get used to it.
Sorry.
And then, Brofo no, the better chim kakran kakra. The working in an amatum was a chim kakran kakra. So the grandma phone, grandpa phone, so better say kakra. And the Sera Medica Kayano, your Korean talk a crab by a banner, a rabbit was.
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid health insurance program. Need help to apply? Contact United African Organization, WhatsApp, SMS IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
Excuse me.
Yes, Yasaba back. A while babum, the crime in a while mebo. But Dr. Beryl, my first question is you talked about flossing, right? So how often do you have to floss your teeth?
Okay, so you should be flossing once per day. One time.
Once.
Yeah, at least.
Okay.
Twice is better, but at least one time per day.
Okay. So, how about people who only brush their teeth once a day? I mean, is that okay? Or, is that any kind of effect?
Yeah. Well, the way we usually present it is twice because that's what we're recommending because we found that in the morning there's some bacteria that has multiplied during the night, and then in the evening you have so many things that you've eaten and exposed your teeth to. So twice is better. But to be honest with you, I have met patients who told me they only brush once and they are doing a very good job and their teeth are healthy. So some people can get away with it. It's kind of like some people don't do the right things, but they're still healthy. So, but preferably, advisably, you would brush twice. That there's reasons for that, morning and evening. But once, if you can only do it once, that's also helpful.
Okay. My next question is: there are some people who, when they wake up in the morning, they actually eat before they brush their teeth. Is that okay?
Yeah, I get this question a lot because people wonder how should I order it. So the answer I'll give is actually if you can brush your teeth first thing, it's better.
Okay.
The reason why is because once you eat, your teeth get exposed to different things, especially acid. And actually, after you eat, you're supposed to wait a little bit before you brush, about 30 minutes, ideally. Otherwise, your teeth may be weakened. Like, let's say you drank orange juice or something that has acidic, and then you brush on top, it could actually erode your teeth a little bit. So, preferably, the first thing is brushing and then eating after that.
Well, I'll tell my wife that.
Yeah.
Well, I have a question from Facebook from our patients. She says, I've had a lot of people complaining about the fact that they have gum issues, after seeing a dentist. And how true is that?
Okay. Well, it shouldn't be true. It shouldn't be true because we're there to help. But I can see where they may be coming from.
Okay.
After you get the cleaning done, your gums might be sore. Especially because when it comes to us cleaning, obviously at home you're brushing, but when we clean in the office, we have some sharp instruments that it's not meant to poke, but it's meant to actually get in and clean everything, especially even hard things that have hardened. So sometimes after the cleaning, you can go home and feel like, wow, my mouth is a little bit sore, but that should go away after a couple days. Especially if they do a deep cleaning. If they do a deep cleaning, you might go home and your gums might bleed a little bit, but after that, it should resolve.
Yeah, I'm talking about people who says, "Oh man, ever since I've been to that dentist, my teeth has been, bothering me. Now I have issues with my teeth and stuff like that."
Oh, that should not be the case, to be honest with you. I'm not sure. I will have to take it case by case, but it shouldn't be the case. We shouldn't be causing any issues that weren't already there.
Yeah. Okay. Yeah. Dr. Fori, I brought in Dr. Fori too. Producer, whatever. He does everything. Dr. Fori, you got some questions for her?
Yeah, I absolutely do. So when you go to the dentist, I mean, when you lose your teeth, sometimes I think about a month ago, I visited a dentist and it's like they wanted to replace a tooth, right?
Mm-hmm.
And they had to rebuild the bone. What goes into that? Like do you lose your bone when you lose your teeth?
Yes. So yes. Okay. So under the gums, there's bone. There's a jawbone. We can all feel that there's bone here.
Mm-hmm.
If you touch here, there's bone. So the tooth is inside bone. Okay. So if you take a tooth out, then the bone that's there, the level shrinks a little bit because for some reason the tooth is keeping it at that height. So if you lose a tooth, there's some shrinkage. It's usually mild for single tooth, but like let's say you've lost multiple teeth, it can be a lot. So if they want to replace the tooth with an implant or a bridge, but especially the implant is the one that goes into the bone. It's good to have a lot of bone there so that it can be very stable. That makes sense. If there's not a lot of bone, it's like it's something wiggling, but if there's a lot of bone, then it'd be stable. So we have something called bone grafting that we can do. It's like a material. There's different materials they use, sometimes from other animals' bones, or the laboratory has created bone type particles, but they're all safe for use in humans. So we can bone graft. We put a little bit of that material to make the bone strong, so that whatever you put in there to replace it will really be strong. And it gives you a better outcome, because whatever you're doing, if you're doing an implant, you want to do it for life, right? You don't want to do it and have to do it again, because they can fail. They can do an implant, you pay thousands of dollars, and then something happens and it fails. So when a dentist is planning the implant, they want the best outcomes. So bone grafting increases the success rate for implants.
Well, I have a question. You mentioned that when you have a gum disease, you tend to have diabetes and stuff like that. How are those related? I was like, how do you get diabetes from having a gum disease?
It's a stretch, and people are like, "What?" There's different connections that they've established. I think in the case of diabetes, it just has to do with when there's not good control of your blood sugar. It affects also the way the blood supply is in the mouth. And there's different connections, like blood supply, and also when there's inflammation. Sometimes there's more inflammation in the body because of the diabetes. It just makes your gums more prone to that type of inflammation. But they have a more detailed explanation. But basically, it just has to do with your cells and the way that your cells are behaving as a result of the blood sugar being imbalanced. It also has an effect on the gum health as well.
So when you brush your teeth, right? I know Ghanaians, we tend to brush hard.
Yes, it's a problem.
Someone that I know, when they go to Ghana, they don't like the brush over here. They say it's too soft. So when they go to Ghana, they come with that hard one, and then they brush the teeth, and sometimes they bleed.
Yes.
Is it because of the brush, or is it because they have issues with their teeth or with the gum?
It could be both, but what I've seen in our community is that people want the hardest brush, and they want to brush hard, and it's actually the brush causing the bleeding at that point. Okay. Because it's more about the technique, the angle, and the circular motion and all of that than it is the pressure. Because if you brush so hard and it's bleeding, it can actually make the gums kind of recede. Like the gums can kind of get irritated and shrink back a little bit. So we call it toothbrush trauma. So a lot of Ghanaians do that. So really what we should be doing, even back home, they should be doing that. If they have been educated about it, is a soft or medium. It doesn't have to be soft, but somewhere in the middle, not hard. That type of toothbrush is better.
Okay, go ahead, Dr.
I have a question about like tooth whitening, right? So you see a lot of toothpaste on the market that have like whitening ingredients. Mm-hmm. And its connectivity to sensitivity of the teeth and how strong the tooth can be. Is there any, I would say research done as to the benefits of these tooth whitening agents and procedures?
Yeah, when it comes to whitening, it's completely cosmetic. And it's not a bad thing to whiten. It's good. It can help people increase their confidence. They have so many compounds that we use for whitening. The ones that you'll see in the toothpaste and even the over-the-counter products are a little bit more mild. You may experience a little bit of sensitivity. It's healthy for your teeth. It's fine. When you get to the ones that the dentist does, we have some in office and some that we kind of prescribe to you. Those are very strong. And so those, you can actually get very, very sensitive teeth from whitening in the office. And that I wouldn't advise you to do more than every year or 6 months or a year. But some people do it excessively and they have a lot of sensitivity. It's not that it's damaging your tooth, but it basically is putting this product back into your enamel, which is the tooth structure, over and over, and just kind of making it, irritating it. So it's something that you wouldn't want to do all the time. And you could do it at the dentist, and then at home you can continue with the whitening toothpaste. But it's not damaging. It's just that the chemical itself can kind of irritate the tooth structure, and it can become very sensitive. So you have to be careful with,
Well, our patients came back again asking about oil pulling, right? And she said they do with coconut oil or sometimes with olive oil. And it says it helps kill bacteria on the mouth, and that prevents gum disease. And she's asking, how true is that? And how often do you need to oil pull?
Okay, I've heard about this, but it's not something we learn about in school. This is another one of those. There's a lot of naturopathic stuff in dentistry that, as a dentist, I have to do more research to learn like about them. But oil pulling is not something I learned a lot about in school. So it's not something that is like an official, like we promote it as far as especially the gum disease. But I know I've read a little bit that it has that effect on decreasing bacteria. And so if it's decreasing bacteria, technically it should help prevent issues like gum disease, but it's not a very established connection that we promote as dentists, generally speaking. But you'll see some dentists have done an extra training or research on naturopathic methods, and they may be promoting this more than maybe I would, just because I haven't done a lot of research on it. But I will say I've read that it does decrease bacteria, so it may have that effect as well. I would, if you're going to do that, obviously I would do it in addition to all the other things that I've talked about, all the right techniques, and also seeing a dentist as well, and just making it a supplement to everything else that you're doing.
Well, the questions keeps coming from Facebook. I'm going to show this one. This one comes from Dr. Araba Cromwell, and she's asking technical questions.
Oh, she has the terminology and everything.
Yeah. So, yeah, I believe you've seen the question. She said thank you for the presentation. She's asking about dietary changes that we can make that will improve our health. So let's talk about that before we go to the next one.
Okay, actually, I'm really glad she brought that up, because now that I think about it, I didn't spend a lot of time on that. So that's important. So just in general, dietary changes would be decreasing carbohydrate intake or sugar. So decreasing the amount and the frequency. So we have to just take a step back and think, where are we, what sugar are we exposing our teeth to throughout the day? So I hope most of us are not eating candy all day, but probably not. But then think about the drinks you drink. The drinks is where it's hidden. So soda, but also even juice. A lot of products is like hidden. If you go read the packaging, you see how many grams of sugar. So you want to go more towards water than those drinks. I mean, it's nice to drink those drinks, with meals and things like that, or when you go out, but you want to do more water. You want to drink a lot of water, because what water does is it hydrates you, but it also flushes your mouth out. So that's very important. You want to think about the frequency. So let's say that you like to drink a cup of juice every day. So there's a difference between if you drank that juice with a meal versus if you drank it all day. Every hour you took a sip. If you're drinking it all day, your teeth are constantly having the exposure to the sugars. Versus if you drink it with your breakfast and you drink water and you go about, that's like the exposure is quicker and you flush it out. So we always talk about frequency and duration in dentistry. So if you're frequently exposing your teeth to sugars, you're more likely to have a lot of these issues. That's the main dietary change. And then there's sugars and other products. Even rice has sugar, like things that we don't think have sugar. But you just don't want to be exposing your teeth to a lot of sugars all the time, especially the processed sugars that you find in juices, teas, soda, desserts, bread, candy, all of those things. Eat it, drink your water, and then go on. Don't be snacking all day on stuff and have something in your mouth all the time. That's the biggest thing for diet.
Let's go to the second the second part of the question. She's asking what causes bruxism, if I got it right. That is an involuntary teeth grinding. What causes that?
So involuntary tooth grinding, most of us are not aware that we're doing it because it's most commonly occurring at nighttime. So bruxism is grinding. It's just you're grinding your teeth back and forth. A lot of times people will do it in the night when they're sleeping. They'll be grinding their teeth or clenching. What causes that? I would say the number one is stress. We all live stressful lives, especially here in America. So sometimes unbeknownst to people, they're just grinding their teeth at night. How will you know that you're grinding your teeth? You might not know. One way you'll know is you wake up in the morning and you feel some headache or some tension here, like maybe some pressure or tension, like you've been putting a lot of pressure overnight in your mouth. So a lot of times stress or just like a nervous habit. Some people do it during the day, and they're aware, like they're just like sitting down, clenching their teeth, and then they realize it later on. So that's how it's caused. If you're seeing a dentist, the dentist can tell. Like I can look at X-rays and immediately tell that they're grinding their teeth. I can look at X-rays. I can look in your mouth. Some people even just smile, and I see their teeth are getting short because they're wearing them down. So the way to prevent this from continuing is something called a night guard. It's like a retainer. It's something you wear at night. And then if you're grinding, you grind into that instead of the teeth. And so that's something that you can actually, if you figure out or a dentist tells you you are grinding your teeth, you can buy that. They have them online. They have them in the grocery store, the drugstore, pharmacy. If you go to the same place, you buy your toothpaste, you see something, it's like, it says night guard, and it looks like a little plastic, and then you either boil it or microwave it, then you bite into it, and it molds to your teeth. That's the over-the-counter. Now we have the one that we can make in the office. The dentist can basically facilitate it being made in the lab. We take an impression or mold of your mouth, and we make a custom fit, and you wear it at night. That's better. That's way better than the over-the-counter, but it's also way more expensive. So basically, if you think you're grinding, ask your dentist about if they agree, and if they can make a night guard for you.
All right, let's go to a third and final question. She's asking about the natural ways we can help with white teeth, like teeth whitening, the natural ways. Let me add Dr. Danso's question also to it, because I think they kind of connected. It says, is activated charcoal good for your teeth? Because some people use it for teeth whitening.
Right. Okay, so the natural ways to keep your teeth white, first off, will be preventing it from getting stained. So ways to stain your teeth: coffee, a lot of coffee. People who drink coffee every day is constant exposure. It just stains your teeth. And then tea, hot tea, especially dark teas, can stain your teeth. And then Coca-Cola or dark soda, Pepsi, Coca-Cola, they can stain your teeth. And then some other stuff. So just be careful if you drink those type of drinks often. Basically, you can minimize it, or you can drink more water also to flush everything out. So you can prevent it. Other ways to naturally stop to whiten your teeth. There are some products that are a little bit that can kind of polish your teeth, such as baking soda. I wouldn't say you should use baking soda all the time, but you can add it maybe once every day or two, a little baking soda to your toothpaste, and it kind of scrubs your teeth. I know some people have found that their teeth become whiter when they add a little bit of baking soda. And then there's the whitening toothpaste that usually helps whiten teeth. There's the whitening strips, and then there's products like charcoal. I did some research on charcoal a little while back, and basically from what I saw, charcoal is actually helpful for your teeth. It is helpful for whitening and kind of like cleansing your teeth. So they have some toothpaste that has charcoal in it. And then I know like you can get actual charcoal and do what I'm saying. Add a little bit to your toothpaste and brush with it. Doesn't have to be every day. It can even be a couple times a week. That should help kind of scrub your teeth off. But you also want to make sure that regardless of what supplements you're using, look at your toothpaste when you go home. Okay, most of you should be using just like, regular over-the-counter toothpaste. The toothpaste should have fluoride. Fluoride is a chemical that prevents cavities. It makes your teeth stronger. So if you're going to use charcoal, if you're going to use baking soda, like you need to make sure you're also using a fluoride toothpaste. And in America, the way our system is, the toothpaste should say American Dental Association seal of approval or seal of whatever. So ADA, American Dental Association toothpaste, or fluoride, just make sure it has one of those on the toothpaste itself. That means that we as dentists are promoting that toothpaste as helpful to prevent issues in your mouth.
All right, Dr. Cromwell came back with another question, and this one is addressed to Dr. Fori. I know Dr. Fori is not a guest today, but it looks like his expertise is being needed. So the question is, she's asking about teeth grinding, right? And she's saying, if it's a behavioral health issue, then what medication would you recommend? This will be for Dr. Fori.
Yeah, I mean, I wouldn't want to mention medication.
Okay.
For the benefit of, health expertise. And
okay.
things like that. But Anxiolytics and some antipsychotics will do that, especially the atypical antipsychotics will do that. Aripiprazole is one of those that can help you with control of behavior, like having tics, stuff like that, Tourette syndrome.
Mhm.
These are all things that I think what you call atypical antipsychotics can help.
All right, Dr. Cromwell, yeah, that's the answer for you. And we have another one from Joanne OJ, and then she says thanks, Bell and Alco Radio. Yeah, thank you too. She got a few questions, right? She's asking how early, like the age that parents should take their kids to see a dentist, and how often, and then the follow up with how many times should an adult visit a dentist? I think that you said twice, but for the kids one, you didn't mention that.
Yeah, that's a great question. Sorry, I didn't incorporate the kids part. That's pediatric dentistry is a whole other topic. But okay, so they start getting teeth when they're 6 months. I mean, that's very, very young. That's a little baby. They start getting 1, 2, 3, 4. It's so cute. They just have a little bit. So the way they teach us in school is at that point they can even go 6 months. That's a baby. But they have pediatric dentists that that's their specialty. I will say more realistically, 1 to 2, 1 to 3 even. But I would say 1 to 2 or 3 because by the time you're about 2.5, you have a full mouth. Like my daughter's about to turn 2. I think she has them all except this. She needs some in the very back. So she's free to go by 2 years old. Like little toddler, they can go to pediatric dentists. What's good about that is that you're exposing them to that atmosphere and allowing them to get used to it. It's not the same as when an adult goes. What they do is you as the parent, you hold the baby in your lap and then the baby puts their head into the dentist's lap. And the dentist is a very quick check. And then they use a toothbrush to brush the teeth really well. And then they put fluoride. We have a fluoride we use in the office. That's a little bit stronger. And that's very important for kids because kids, their teeth are a little bit weaker and they're more susceptible to cavities. Now, you may be thinking, oh, baby teeth, it doesn't matter. They're going to lose them all. It matters because they have to have them for several years. It's not till you're like 11, 12 that you really develop most of your adult teeth. So we don't want you just treating the baby teeth anyhow. It's important that you're getting them checked, getting the fluoride to prevent cavities. And it also sets the stage for your adult teeth. So some people will have certain issues with their baby teeth and it kind of extends into the adult teeth because it was not addressed. So like to answer that question, their little toddler, 2 years old, you can take them to the pediatric dentist as early as 6 months, but hopefully by 2 or 3, just so they can get that exposure and that experience. And you'll see that pediatric dentists offer a wide range of everything I talked about. They do it as well if the kid needs it. And they have an atmosphere that's more comfortable for the child, usually very colorful games and toys, so the child feels comfortable. How often should adults visit the dentist? This I would say for children and adults. Once you start the kids and then you yourself, 2 times a year. That's the kind of prevention. If you can't make the 2, then at least 1 is good. Just so everything's getting checked out. And that way, like I said, there's a lot of things that we can do for you if you're being seen by us 2 times a year.
Okay, I think Dr. Danso is more concerned about that charcoal thing. So he's asking, is it just the charcoal or the one that the activated charcoal that is good for your gum?
As far as I know, I think when I read it was more the activated charcoal. But that's one I have to do more research on, to be honest with you. I'm not an expert. But I think it was more so that activated charcoal. But I'm sure there's a benefit to both because it has to do with the abrasion and it actually scrubbing the teeth, and it has to do with just the components that are found in charcoal either way. But I think it was activated charcoal.
So that one, I think the charcoal has a lot of carbon and it picks up a lot of toxins.
Mm-hmm.
So the activated one is basically you breaking the surface of that charcoal because regular charcoal that you have, it doesn't have it picks other things. So in order to activate it, you need to pass it through a lot of processes to expose the surface to pick up the toxins. So that's the difference. So activated is better than just a regular charcoal. And
yeah, that's why drinking as well.
How we used to use it back home, right?
Yeah.
With the what is it, the plantain, whatever.
Mhm.
Yeah. So
Body tree.
that's what he's probably referring to. But yeah, that
Yeah.
one what we have at home might not do justice compared to an activator.
All right, Dr. Danso, your next question, I see borrowed or come again. I didn't get that part. Please come again.
Oh, I think I know what he might mean by that.
Bottled water and
Yeah.
Okay.
Okay. So tap in the U.S. in a lot of places in the world, in tap water they put fluoride. They actually put it in tap water, and so it's the tap water is beneficial because it exposes your water, exposes your teeth to fluoride. But most of us are not drinking tap water unless you have a filter or something. Most of us don't drink that. Most of us drink bottled water. Just be mindful that bottled water does not have fluoride. It's not really a problem. It just if you need to get fluoride at least from your toothpaste, or sometimes the dentist can apply fluoride. But some people will specifically drink bottled water, tap water for that reason. I bought I just have a filter, like a pitcher filter, so I drink tap water and I know I'm getting the fluoride. But some people, even with the filter, don't like the flavor, especially depending on where you live. Some places the water has a strong flavor. So, yeah.
Yeah, if you live in Flint, Michigan.
yeah, exactly. You might not want to drink that water.
Yeah, Ibrahim, I'm just reading comments from Facebook. Ibrahim saying this today be today. My granny is eating salad anyway. And then he also saying that there's a myth in Ghana that when a baby put a comb in his or her teeth, their teeth will be misplaced or have a multiple teeth. Oh, my goodness. I don't know how true that is. I don't think that is true. Do you believe that?
No, I don't think it's true.
Okay. Let's go on to the more serious questions. Dr. Cromwell came back again and she's asking that how often should we be getting x-rays at the dentist? Because she feels that every time you go to the dentist, they want to do x-ray. And she's thinking about the exposure of radiation.
That's a good question. I will start off by saying that the radiation dosage for dental x-rays is very low. It's very, very low. It's something that if you were getting exposed to it all the time, such as like a dental professional, you would want to think more about it. But how often should you be getting x-rays? I would say about once a year. So it shouldn't be every time you're going. If you're going twice a year, they should be utilizing the old ones. And then the once a year, they can take them. If you're a brand new patient, they might take a lot at once. I know the office I was working in, our standard was we would take what's called a full mouth. So you'll see they'll put all these so many of them, they take so many pictures. And it's just very good because it gives the dentist a very broad picture of your mouth. Things that you can't see with your eye, I will see. But after the next time you come, we should be able to look back at those and then do it again the next year. Some dentists, maybe you'll still see something and they say, okay, we did it last time, but we want to take a few this time. So just talk to your dentist about that. If it's been more frequent than yearly, they may be able to cut it back, especially if you're a healthy patient and they're not seeing a lot of new issues. Some patients, maybe they present and I'm like, I want to see a view of that. I'll tell my assistant, go ahead and take this particular view because I want to look at that again. But it shouldn't be every time.
Yeah, Mahdi Abdullahi came up with a very interesting question. The question is, can you replace can you use mouthwash twice to replace like brushing your teeth?
Mouthwash is another one of these supplements. So mouthwash is good to add in, but you can't do it in place of. So You definitely need to be brushing still. But the mouthwash is another way to flush out bacteria and all that. But it's just something you can add into your routine. You can do it once a day, you can do it twice a day, but you should brush as well.
I know some people who use the brush in the morning and then they, when they're going to bed, they use the mouthwash. Is that kind of okay?
Instead of brushing?
Mm-hmm.
I don't advise that. I advise brushing because there's plaque and there's things that are like really adhere to your teeth, even in one day, that the mouthwash doesn't get.
Yeah, Dr. Bedu also came back and, he said that, the charcoal we have in Ghana, he's actually, describing how that activated charcoal is done, and he's talking about how it is, being heated to high temperatures, right? And then that makes the I think it's kind of contributing. Let's go to the questions part. I think he also came out with another one that says the one we have in Ghana is activated charcoal, Dr. Fori. He said, don't let American branding fool you.
I mean, it's not activated, it's common charcoal.
It's common charcoal,
Yeah.
okay. But it's heated though, right?
It's here, but you need to put gas or something through, or you do a high temperature to make it more porous.
Okay,
Yeah.
so Dr. Atu and Dr. Fori kind of have different view when it comes to the charcoal we have in Ghana. All right, I have a question about the how do I put this? Like, you go to a dentist, right? And then every time people go, they're like, oh man, this dentist want to do the root canal. They want to do this, they want to do that, they want to do that. So there's a perception that, hey, if you go to the dentist, they want to make money off you, so they recommend a whole lot of other things. Do you think that is true?
I think that perception is definitely there, and maybe there have been some dentists who have done that. I think this new generation, at least from what I know, the way I was trained, we only act if we have to act. We don't want to drill on a tooth if we don't have to, because in the past, I would say the way they trained dentists, it was like something has a little cavity, just drill it, just do a big root canal, just do a big crown. But the way we're trained now is like, do the least. Like if there's something, just do a little bit, or if you can just keep an eye on it, and then monitor it. So hopefully that we're moving away from that. But if a dentist is practicing ethically, they should only be recommending something really if it's needed. And they should also have a dialogue with you to kind of explain. And we have so many tools. Me personally, in the practice I was working in, like I will show the patient the x-ray and kind of try to explain what I'm seeing, so that it doesn't feel like, oh, I'm just giving you treatment to add to so I can produce more dentistry. So anyway, it may have seemed that way for some dentists, or maybe because they're just, every dentist is a little bit different as well. Like two dentists can look at something and one will say do a filling, the other will say keep an eye on it. Even though we're trained, there's a little bit of gray area. So anyway, it should not be that way. It should be such that what you need is what you're being recommended. And definitely ask questions when they recommend things. Sometimes patients are just like, oh, that's what they want me to get. And they get the price. They're like, I'm not doing it. And they just leave. But maybe while the dentist is in the room, like try to ask a lot of questions as well. Why do I need this? Can you explain? Is there other alternatives? And you'll find that the more questions you ask, more information you'll get. Sometimes there are alternatives. Sometimes patients will say, do I need a root canal? Can I get a filling? And I will explain, oh, this is why I recommend the root canal. We can try the filling and then maybe it'll be sensitive later. Or this is why I recommended to take this tooth out, but we can try to save this tooth doing this. So just try to dialogue with the dentist. And if you feel that way about a dentist, I'm not saying jump around, but there's always a lot of different dentists. Right now, there's a lot of dentists. So if you feel that way very strongly, like, I don't know, you can get a second opinion. It doesn't mean that they're going to give you, another dentist may give you a different plan, but they could also maybe explain it better or give you other options. So we're not trying to take all your money, but I will say it's expensive. Dentistry is expensive. Yeah.
Yeah, they have. I also that they have insurance that people use to cover the cost. Yeah. And it looks like Dr. Ofori and Dr. Atu, they're saying Dr. Atu is still saying that the charcoal in Ghana is pretty much activated charcoal. So that's what he is saying. But the pharmacist is saying otherwise. So we will leave it at that. And then Maddie came back and is asking about artificial, is it diastema or the steamer? I don't know how you guys pronounce it. And how can one give birth? Sorry about that. How can one give birth to a baby with diastema? Cause is beautiful. I mean, Me personally, I don't understand the question, but maybe you do.
Oh, a diastema is spelled. A diastema is a gap.
Okay.
Like you have a
Oh,
diastema.
the one that I have. Okay.
You have a diastema. Yeah,
Okay.
the gap here.
Yeah,
Usually.
the gap. Yeah. People say it's nice,
Yeah, it's actually very common.
but I want to close it.
You want to close it? So I had it and I closed it. So
Okay.
I had it and I did braces some years ago and I closed it. That was just me. I like the way it looks now. But diastema is beautiful. Some people like it, some people don't. So that's where we get into braces or orthodontics. So I think that's what she's talking about, because we can move teeth. We can move them with braces. Braces is metal wire that's going to actually slowly move the teeth. And then what's more common now is Invisalign. I do a lot of Invisalign. Invisalign is clear aligners that will shift your teeth. Most people are candidates, not everybody. If your teeth are arranged in such a way, you may actually need the metal braces. But when she says artificial diastema, I guess she's saying somebody who didn't already have a diastema, but they want them. That can be done, but what's more common these days is actually closing it. At least in the Western culture, people tend to want to close it. These are all options that should be discussed with an orthodontist. So I didn't touch on this, but we have so many specialties in dentistry, so many specialties. One of them is orthodontics. They just deal with moving teeth, braces, and those type of things. Now, some general dentists like me do Invisalign. So I could close the diastema with Invisalign if I determine that, you're a candidate. Before you can get any of that done, you need your teeth clean. We need to make sure everything's healthy. But like if you wanted to come to me and get Invisalign, that's something that you could do. And it's like trays that you'll change out every week or two, and it will slowly close it. And at the end, it'll be closed. And then we give you a retainer to wear to keep it in that position.
And how expensive is that?
Invisalign?
Give us a ballpark.
Yeah, it's going to be like $4,000.
Okay.
Yeah, but usually the way it's done is it takes some time to do it, and it's usually like a payment plan, like you're going to pay so much per month. If some insurance will cover some, you can always look into that, especially if you have kids and you want to do this with your kids. Usually for the kids, the insurance covers some of the braces, and then adults, some of the insurance will also cover some of it. So like, let's say they'll cover like half, then that would be $2,000 out of pocket, or something like that. But it's a range. And I do want to comment on this because there's, you'll find that there's some that they're promoting now that one is called Smile Direct Club. They mail you the kit. You take your own impression and you mail it back, and then you do it from home. Those you'll find are like way cheaper, but they're not safe. We don't promote them as dentists. We promote doing it in office with a dentist. It's gonna cost more, but there's so many issues that can take place when you're moving teeth. If you're not careful and they move them too fast, they become loose. There's so many issues with moving teeth. So just try to do it with a dentist in an office, however you're going to do straightening teeth.
Yeah, Maddie is saying that I guess moving the teeth, I think, he's trying to say can buy a land in Ghana.
Yeah, it's expensive. Yeah, there's so much to do with that money.
Yeah, and he says, thanks for your reply and God bless Akko Radio. God bless you too. Keep your comments coming. We have about, let's say, 5 to 10 minutes to wrap this up. And then we're going to bring you Mohammed's Corner, where we talk about trending things, health issues that is going on in Ghana. That is purely in Ghana. So we talk about that, and then we end the show at exactly 12 o'clock. Because Power Sports, they're doing wonders. Power Sports is here today. So right after health and wellness, we have Akwasinimo and his crew who will be coming in for Power Sports. All right, so let's go for a quick commercial break, a quick one. And then when we come back, we will ask a few questions and then we'll wrap up the show.
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid Health Insurance Program. Need help to apply? Contact United African Organization, WhatsApp, SMS IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
Yo, yes, I'm a Beryl Otchere. So how the wonders now would see? And then the account was some dental health. Now you Dr. Beryl Otchere and I education como. Now our church and money baby, no money no, and then what church him am I questions are bending no, but more than answering come on my. Now you you move on the Mohammed Conan so Ebano. You better about wrap up kakra bi amaye so the be ya friend will be I didn't feel out to what is going on. So we just want you to wrap up, so that if someone just tune in, then they'll be able to at least get something of it.
Yeah, well, I guess just to review everything, I was able to talk a little bit about why teeth are important, and I hope I convince you your teeth are very, very important because there's so many things that we do with them, and there's so many issues that can happen. Infection, cavities, gum disease, if you're not taking care of them. So please try your best to take good care of them from home, brushing, flossing, and also seeing a dentist regularly. That will also help you to take care of them and keep them for your lifetime, because if not, then you're missing teeth, and then you need to talk about how can I replace them, and that's another issue. So just take good care of your teeth. Be careful with your diet, the sugars you're eating, and that's how you can, and also seeing a dentist, how you can keep your teeth for life and keep them healthy.
Well, thank you so much, Dr. Otchere, and I believe Dr. Bedu also is thanking you for this information that you have given us. Thank you so much, and we hope that the next time we call on you, you will come in and then help us. We're doing this for the Ghanaian community, and as Ghanaians, right? We cherish our doctors, our nurses, our healthcare professionals, and we cherish you too. Thank you so much. God bless you.
Thank you.
Thank you. Dr. Cromwell was saying excellent program. Thank you. Yeah, thank you so much. Okay, so we're gonna take a commercial break, right? And then we'll come back with the Mohammed's Corner. This is gonna be just 30 minutes, Mohammed. Please, it's 30 minutes because I've got Cinema is here. All right, so we're taking a commercial break. When we come back, it is.
Hey, this your girl coming all the way from the US of A, yeah baby, aka yeah Bantam. And me di fill up bows in pan and to see one roach with your money how Ghana mat ada romantic. With me sandy provisions, as I track credit, Emma Ebusia phone and for more Ghana. And one say ubako www.ghanamat.com. And they would say, boy, a sharp connection. www.ghanamat.com. Provisions in credit na really angazankaza. I have friend numbers na screen aseno. Ghana Mat ye krano.
Ghana Mat ye krano. Ye try say the Mohammed Beba. Answer na Beba no. The kika wansem nyina no. Extra say so wo bibia so ko hu dentist in terms so the beya obobo modina obo ama bibia akoso.
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid Health Insurance Program. Need help to apply? Contact United African Organization, WhatsApp, SMS IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
Mpanin kan a wɔmmoa sɛ ɛnyɛ obi biribi ɛne obi na mo obi biribi ɛne nea a wayɛ ne yi abusua ɛbrɛ ti sɛ mu so obi bɛdom aboa wo ama wo kakra mpo a na oni akono dwene ho yie paa. Well remit enim ne din a ɛyɛ tutu ɛfa sikasɛm ho onim wabɛbrɛ sɛ mmɔde w'adwumaden ɛne mmɔde biara a wobɔ sɛ wobɛma efiefoɔ nso ɛho ahenha wɔn ɛne nti well remit ɛde nhyehyɛ pa agua kwan mu sɛ wobɛtumi ɛde sika ama ne efiefoɔ ɛwɔ abɛɛfo ɛkwan so computer, smartphone anaasɛ app a ɔhaw biara ɛni ho. Sɛ woyɛ a new customer anaasɛ ɛyi ne deɛ a ɛdi kan ko adeɛ a atadwe wate dɛnɛ ɛne sɛ wobɛtumi ama ne sika free bonto a wontua ɛho hwee ɛma well remit. Saa ne mprɛnsa so 3 times wompɛwei na wopɛ tiɛn ɛne gye sɛm ɛne sɛ wobɛtumi ama ne sika yi akosi MTN anaasɛ Ghana network biara so a ɔhaw biara ɛni ho. Well remit woyɛ yɛ sɛma nhyia mpa.
During this period, any little savings helps. World Remit knows how hard you work for your money and are making it easier for you to support your loved ones. World Remit prides itself in offering you a fast, simple, and secure way to send money abroad from the comfort of your home using a computer, a smartphone, or an app. If you are a new customer, enjoy your first 3 money transfers with no World Remit fees whatsoever. Use promo code 3FREE. World Remit, a better way to send money. Terms and conditions apply.
Hey, this your girl coming all the way from the US of A, yeah baby, aka ya Bantam. And me di feel a boozing pan and to see one virtue the money how Ghana mat ada romantic. What's me sending provisions? Esa sutra credit Emma Ebusuya phone and for more Ghana. And one is a www.ghanamat.com. And they would say, boy, a sharp connection. www.ghanamat.com. Let's try provisions in credit. Na I have friend numbers na screen Ghana Mats ye crano.
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid Health Insurance Program. Need help to apply? Contact United African Organization, WhatsApp, SMS IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
Yo, it's Abba Mwakaba Bio, about health and wellness. So you're trying to Muhammad now, a fan or the Muhammad's corner, no Abre, and one in Ghana seminal. Connection, no, it's like a cry, and your man said, I'm queer. I don't know now, Yenya Muhammad, by you push on 1% if me at the Naba. And to Biano, but making sure, say, at the Bassona, Bibiano, Abramo. Yes. Na sọrọ we nya mind be say twa ho kakra bi nya afa no e de aka nya so abram ye ba na mo abade nya ready ye be rap show no.
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid Health Insurance Program. Need help to apply? Contact United African Organization, WhatsApp, SMS, IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
Yes, I'm back to you. See the moon, you know, Mohammed just say, well, I did just them come. Mohammed,
Me took up our
I said that they have more from the city.
uniform. I was so
From wall. Sababo. Another I got more. I got more. And another 15 minutes. 15 minutes into Mr. Wa 15 there, yeah, and
15 what?
15 minutes. At the moment, and then I got so Ghana. I just say,
Right.
near Casa Bassano, the Bassano, the Monyabi.
I mean, Masano, a number midri still. A number midri still. Come na I'm meeting can last you concern man share and sinipi. And I mean, Dr. Penny because I said, you cry like in Yenya. And it has been a year trainer. I'm mindful for baby now or more heavy anymore. Omunyamba and of course. Then I don't see eternal. In Yama, yes, was middle of July. At the first week of August. You see, last week of July, Muni Equi. And hopefully, anymore say, as I said, I go so stressful. Ebi I know see next week, and I said, now, okay, be seeming Korea. And then, of course, Nana Ado, say Ghana, penny, any ebidi and common. And the Nipadona cry, I can say, Ebiana, Enyabi, and I say, Ebiaba Bidu, but can change Nana, Ebi breaking news, Ede Amayan. So, of course, and when any but the Mekasa Ebiaba, Sisi, pa dia kwame na meboa ebinyamba.
Okay, na say ebinyamba no dey na mo ye dey abom ho ban.
Dia ye dey abo ye ho ban dey kwame as usual the fufuru bi eni ho dan say ye be wo hye sane ya hye nose mask no. Don't forget say just a few days back and before edi omo press relief edi by say obia embo no so a ebi mo ye omo asori wo dem enti we no enhye my say omo nye asori outside and then very ka bucket na ebi ayi omo de free adwuma ma say omo de ko kwame ebi de ko nsuo omo ensan fa nko back to the eat grounds na omu fie kwan no omu sanso nko na fi so se na wo hu se nkramofo ya soro omu bobo ho no this time round there say omu etete omu entem na ye hwe anwoshin ye enti no as usual nanka kanena of course idi beduru a uko zongos nya de ombe shishi jama anwumre duru a ombe he this year no because of covid enti no and sheda anko strosa but I think make say in general Ghana for na ebi mo perception no ewo form fi so mu hu say ade no still I ni ho omo pese mu hu omo manya bi kwame news bi trend ewo Ghana I think say was here ma atifo ete na omo hunu na say was omo investigation here already free UK by within this week now oh yeah 72-hour test covid test ni bi and ordinance set edru kotoka odru kotoka and of course I was say sign a test for on any ba 6 years old and by ne ba ne de negative but awura no e de issue say when ya covid entina no wan kakra say oye within 72 hours and now they by 72 hours grand enyanso ye aka 24 hours enti den now dia adwene say say positive no oman go straight to the point and can't no meba twen yemfa say when you covid dey omo breaking news na ma wa is as if you say you was when you HIV bi and I say yare bi as very serious we intimi can't chop and then omo catch and say onko a particular hotel 195 Ghana cedi so they were contemplating I didn't me be most searching time well me niama wa ha e was a test I think UK yama teachers and nurses no yama dodo na yeah we need be RDT rapid test na umutima this lady did it and is still negative so it's been adia Ghana so far for na can was is it true say omo de gear to raise the nipa dodo no omanya covid se na be omo beka kwajo musika no because se kwa me last week na me ka se nipa dodo na no ehunu se ade no eni ho nti me advocacy ya na me yen say e wo se friends announcement ye mo na fi so mo amwo no ho ana amani ehuhu omo manya bi no omo afrefia me nuan ma mutie me mo mahu omo manya bi mo hu omo sen yen so say mo frefia mo kan kire omo say the thing is real because nipa dodo na enya covid say kwa me cases no increase now oba last week na achimota oba Ashanti regional 4 schools pe are reported nipa by 100 omo enya covid kwa me ade esan emane we ni say nipa dodo na omo enya no symptoms be an show it's more or less like normal malaria symptoms okay now doctor na predict say yenya no covid test yenya test na positive right so eno na emane very risky say youth dodo na no enya SHS for the nkrano secondary school nkrano omu nya but say omu no omu show symptoms what about omu kofie so omu wo I mean just last week after yeah program last week no now there was a banter between Ministry of Health and Ghana Education Service. Ghana Education Service had wanted Nkora to go home, especially final year students. Mobile Abewe Secondary School. News no buy schools no be bema Nkora akona. And Ghana Health Service from say Omuma friends Nkora no kofi. Omo order Ghana Education Service na Omanko. So there were 1 or 2 schools omo demonstration. Kumasi Girls for instance, omo demonstration to the extent that or say police voba and SMP na ACCA. So senior anytime be amaka na say every day be amaka no. The information isn't flowing. Kwame information I was say ban enye eno na yenya ntia na de nana one thing too is that nana bana oba ene no nipa dro na no abamabu free say politicians no ko omu ayi a omo nya hwe omo enworo mo nsa nti mo nworo mo nsa na mo nya de o se mo ya how much more say yen na yen nya hwe no mo na mo expect say ye because now no I say Ghana for is basically that is what is happening now. Nti say ene Ghana be your friend say ye besa na na be ka say nya lockdown see ye be ka say friend say school for them. And then also Kwame 1 or 2 people be na omawo vaccine omaji 2 jabs ni na Omagi 2 jabs in an still Omashu positive. Okay, so and also the money padrona who say look, yeah, young will be crying shoe positive. Or more will be no much positive. Ain't you know, sending this misconception. Eba say or more air train and money be no more day way or more the chip be she moon then it seems that news soon winning. Ain't you know, or more head ewo Ghana no. I think and maybe say about omon can tree. I brought from those. There are so many people abroad from Nomote, but why not just say any krum cousin minty? Okay, but say you breaking it down. Na say say GTV nkwa enye, but the other stations no to say Ako radio for instance, more the advert no be ba at least Ako radio bet me aka I'm saying at Kwame and also idea about a friend secretary of Ghana Medical Association. This week say Ghana for you asre say abano asre on say some of the biana maker. Yeah, any mu say ono no e2 Ghana aban for say only proactive. If say omo aye ko sre dey free omo no say omo omo nye proactive and say omo keka omo ho and say if they keeps on disappointing us I don't know ya kasa yemfa enema ento na akwamu na yentimi enye bibi Kwame and also one thing Kwame way back from the COVID no COVID na ehu enkofo aso den now me the bad health related cases Kwame me bad health related cases about 2 weeks ago akora bi akowia 5 Ghana cedi Kwame minim say otemenka wakowia na 5 Ghana cedi
na manako
omo eche no omo di cane era akora ne to omo pushi cane era ne to because wakowia ska ekom de no or the copy we di wako or the omo di cane era ne to ama say 5 Ghana cedi $1 you find say $1 omo di cane era ne to and also ade Kwame ha adwen pa say other hospital I think they were going to do some surgery the amano and then there are some Ministry of Information and also Abi hospital very new hospital the ama ninkofo Kwame these are some of the things that they be can was last week na make say yenu anoma nyame ato omonsem na omanya bi yesremo Ghana metima ka say Ghana hospital bia how how no normal normal how weird say eni kwa say esi esi nti omonsem ewo bia so far no omutimi bo ankofo no yesre omoma tize dia honorable MP etimi asibi edi ama ne nkofo no on dey o consider omo dey airborne life ne ade no Kwame eno so omfanye clinic say cheap compounds kra omo dey anomnya Kwame one thing too researchers aya Ghana has say health workers do no uposti omko northern part of the country omonko eno so yade ha adwen pa to the extent that there are even hospitals at the north yepe nipa ma omakomonko. Just this week here, there has been a news say 5 doctors. Yet you almost corner over almost a monko. Kwame enya omupe me minua ba kon ne wife koye nurse or Kwame enya omupe enya easy e kwan ne nye ya udie kra den ensem pi enti these are and also ye ade ba kon eha adwen pa and then also hospital facilities Kwame anytime bia ye can any
Mama, that's a wine in freezer kakra.
Right. About last week, na me kase last week na me kase security or Pantan. Ha adwen. Enye Pantan hospital nkwa. Kwame just I think less than 1 week ago. Hospital Yakowia hospital be anyama. Oboase. To the extent say Yakowia anyama omsan ko maternity block. Esa so ekowia anyama na maternity block no. Ena minim adekwa no mo ka kopɛ say apemfo no ena se no mo kwa akowia apemfo na mu o say baby minim de wo maternity blogger e wo say akonfo eko holom so I think the security in as much say ye near my hospitals no enko yi no akonfo no hu nipa mobo still an almost answer alcohol hospital akọ ya ade e honom kwame in brief stana meka so far
Yenya Mohammed do asebebrebe na you say no tell me can I consider more about you na ke 2 minutes na wrap on up walk me through this say no Akufo-Addo Ghana president or can say you know cover the mo ka ko to be no nko say no munnim se mo benya bia na say no munnim ho hwe like e dey pa na ekoso
kwame nana sheyebo in fact health minister sheyebo don't forget say health minister no last week kwame nsempii ene bae probe no mo probe no about the vaccines na nko die ho nsem bibiri bae no kwame some of ninsen can be no minister ma ehunu say in fact ahonpepre ene man to no contact na emergency the right route and also for and went edit kwame me catch out say the August we first week ba second week ba na say covid vaccine Ghana fo anya bia in fact ni padro na no abam ebebu dodo na omo abam me for instance say kwame me arehemu say nana boshe na o share any there enema ebetimi ayeyi and I'm just waiting for a ne say nana ebe breaking news na my say look vaccine no enam we mu aba aka one na aba abedru because vaccine dem ka nipa bibiri na ehwe ni mu a na me wakwa me na omo fa first jab say no omo enya second jabs nyina na omo si enya covid no and is more or less like ebu amanfo abam say look ebi awo mienu still omo nya nti no what's up mampe mampe ba bi ntra so eno so ye ade ba ko a kwa me ha adwenpa
yeah Mohammed and no the rates not to say any be any part do say no ma wa omo asanya bi
kwame rate no so far I think from Endra ena sa info yi eba from Endra me ankasa personally enipa 3 me ankasa minimum ena omo awo second jab na omo asanya covid I think so even this afternoon krami follow news I think KOD will be a media guy ono kra so awo 2 doses na but then when why positive you know so
almost show symptoms and I say you know are they hospitalized
no kwame symptom be an in fact KOD the meeting interview no KOD the what he was saying was like or no or you be
I don't say Mohammed internet no afraid Mohammed
or yeah like random test okay one na or randomly
okay Mohammed say America kan I go see the moja me konso and the better was it nyambo next week more time and then na wa onu tua dental you know na hye and nyambo next week no Rebecca cancer ho asem by more time now so what me any edin komo and the was be Mohammed therefore ha na be na be kwa na di duma de ni nyina ba de Mohammed aye
na esimu jure ya titi ya yeko movie o se be 40,000 and $40 I mean etimi to asase wa ha o but o dey anyway me say I go see the money be kon today be me nya tire be kan wasem
on the 4,000 maybe just say we move well to be able to make
obi jina machi 4,000 obi jina machi o se nenka ni siri nyina ntutu on fa ho
all right. I'm ready to the brother driver see you about Dr. Beryl Otchere. Yeah, then I said baby. Sasana Mohammed is also. And then I said Mohammed, you never say this one kind of swat. Only that. Some of the Muhammad and no. As you got a choke around money. So the me sorry na power sports. I'm so mba be jomo bia. Dr. Foy me da say. So na me da Bell, Dr. Bell Otchere. Mohammed e da mo nyina ase. Dr. Foy be ba mo friend Eunice. Dr. Cletus Bedu. Ayenua ato kwamana danso. Ye che da mo nyina ma se ma de che say aduana ba metu oboje no nyina. Da mo nyina ase mo nyina mo hwe na mo tie. Number same time next week. You better have a back. And from the studios of Akko Radio, no, most of Fukwara Manu, Macramo.